Hi, my name is Natea, and today we will be presenting our respiratory modalities. I will be doing the respimat inhaler.
Hi, my name is Phoenix. I'll be doing the bubble humidifier with the nasal cannula.
And my name is Nantaman, and I'm going to be doing the handheld nebulizer.
Today I will be presenting the respimat inhaler. It comes in this little box here. Here's a picture of it on the screen. It's a slow mist inhaler that provides slow moving particles for easy inhalation. So let's open the box. So this inhaler delivers medication without using a propellant, and it is ideal for COPD and asthma patients who struggle with a traditional inhaler. These are a few different brands of medications that use this respimat inhaler. How to assemble. This is the medication and this is the inhaler. There are two ways to open this inhaler. The clear piece is where you want to open it first to insert the medication. There's a little tab on the side that you press and you remove the top. Then you take the medication, you insert it into the inhaler, and you push down very hard until you hear a click. That's when you know it's in. Then you replace the top. Once you insert the medication, there is a little gauge on the side that tells you how many dosages that you have inside the inhaler. Prime the respimat, you have to have it closed. That's the first thing. And you turn it until you hear it click. Now you have this side of the inhaler upright, and there's a little tab on the side where you pop it open. Because this is the first time that you're using the inhaler, you want to point the inhaler away from you. You want to push the button until you see a cloudy mist come out. This is the medication. Now that we've seen the medication come out, we know it's ready. So you close it back, you turn it again until you hear the click. Then you would open the inhaler. At this point, you would sit up straight. You would turn the inhaler this way. Once you put it in your mouth, you want to close your lips around the mouthpiece so that this whole piece is enclosed inside of your mouth. Button up. The button should be on the top so you can easily press it for the medication to expel. So you put it in your mouth, close your lips around, and push the button. Once the medication goes into your mouth, you want to take a slow, deep inhale so that the medication will deposit deep down in your lungs. If you don't take this medication, there are different risks that you can encounter. You can have worsening symptoms, shortness of breath, chest tightness, and potential asthma attack or COPD exacerbation. So it's very important that you know how to use this and how to actually take the medication. This also comes with a pamphlet inside. If you have any other issues, there's plenty of information in here that shows you how to use the medication and just different fun facts about it. Now we're going to move on to the bubble humidifier.
Alright, so I'm going to be presenting the bubble humidifier portion of the presentation. So the purpose of a bubble humidifier is to add moisture when oxygen therapy for a nasal cannula is above 3 liters per minute. At some hospitals it may be 4, but normally it's 3. It's also going to prevent dryness in the nares, so people or patients complaining of a dry nose, if they're having nosebleeds constantly, something like this may help them. So the components of the bubble humidifier, so some of them look like this, where you can take the top off and fill it with sterile water. You also would have your nasal cannula. And then this is another example of a bubble humidifier. It's the same concept, and sometimes we'll use the water from in here into this one, if that's how they want to do it. So you have the nasal cannula portion, which hooks right onto here. And then you would have your top part, which would connect to you need a Christmas tree for one of these. So you can connect it to oxygen or air, and it would go on the flow meter, and you just screw this on and it will stay there with the sterile water. So every time you go in to do your rounds or patient checks, you're going to want to make sure it has water in it, or else it's not going to be working. This one has the exact same concept. The nasal cannula is going to go onto the front piece, and this would go onto your adapter or the Christmas tree. And then your nasal cannula would go in your patient's nose like normal. To be a little more specific, you would have your reservoir or sterile bottle, your oxygen inlet, which is going to be where your Christmas tree is, your delivery tube, which would be your nasal cannula delivery tube, your pressure relief valve, so if the pressure gets too high, it'll pop off. That's going to be on your flow meter. And then you have a diffuser in most cases, which will help break up the incoming oxygen into smaller particles. So more of the mechanism for the bubble humidifier. So it releases a stream of gas into small bubbles below the water surface. As the humidifier reservoir cools and the gas water duration shortens with increasing gas flow, this will reduce the effectiveness at higher rates. And it's usually combined with oxygen to increase the gas water vapor concentration. So these were the bubble humidifiers with the nasal cannula. The next thing that's going to be presented is a handheld nebulizer.
Alrighty, so we have the handheld nebulizer, and this is a portable device that can give aerolized medications. It can be used for anyone that has asthma, COPD, or any other lung diseases. We have 3 different types. We have the jet, ultrasonic, and the vibrating mesh nebulizer. These are some different medications that can be used with the handheld nebulizer. Something that you'll see very common in hospital sites that I have been to is the dual neb. So we want to first start by washing our hands for the handheld nebulizer, and then we're gonna need our tubing, T-piece, mouthpiece or mask, and then we have our cup that puts the medication in, and we have our tubing along with our O2 flow meter. So we wanna put everything together. We put the medication in, put the T-piece here. We put the tubing here. Put the mouthpiece or mask on the other side. You want to make sure everything is nice and tight. And then we have the tubing that goes at the bottom of our cup. Again, make sure everything's nice and secure. And then we're going to have the other end be attached to our O2 flow meter, and it should be set around 6 to 8 liters per minute to get the best results. And then we're gonna have our patient sit in semi-flowers or flower position, and then have them hold it, and then take a couple deep breaths every couple seconds. Make sure it's a nice and deep breath, and then it should last around 5 to 10 minutes. And when this is all done, you want to make sure that you disassemble, and then you dump out the remaining medication so that we do not double dose. I would also like to mention and add on that the handheld nebulizer is best for the patient population that are children, babies, and elderly people, because you can change the mouthpiece to a mask depending on your patient, and we also have different sizes as well, and it's not very dependent on patient effort, because all they have to do is kind of sit there and breathe like normal, and then every other couple breaths they can take a deep breath, which doesn't require much effort, versus a meter dose inhaler or dry powder inhaler, or even the small mist inhaler, where you have to make sure that you have enough strength and mobility in order to take that deep breath. Although all 3 are different,
Each respiratory modality benefits patients in a different way.
If you have any questions or concerns, please do not hesitate to reach out. Thank you.
Thank you.
Thank you.